talk about staying safe in the summertime. Summer means fun in the sun, but it also brings unique health risks like heat rash, bug bites, swimmer's ear, to name a few. Here to help us recognize and treat common summer ailments is pharmacist Angela MacNeil. Welcome back to the show, Angela.
Thank you.
So nice to have you in. So let's talk about what are some of the common ailments that you and your staff see this time of year?
You just listed a few. So sunburn is a big one, obviously. Bug bites is probably our #1 for kids and adults. We see a lot of heat rashes as too, especially when we're getting these heat waves. People are outside, they're sweating more. So we do have a lot of common questions about that. And I mean, the tick bites, those are, probably a daily occurrence. And heat stroke sometimes too, especially during these heat waves as well.
Well, let's dig in a little bit on some of these. Let's start with the bug bite. So first of all, when you know if a bug bite is dangerous?
So when you start to see a lot of redness, a lot of swelling, we'll get you to come in, we can take a look. We can assess whether it's just an allergy, an allergic reaction, or if we think there might be infection. A lot of times we can recommend some over-the-counter creams to take to help with the itch and the redness, some allergy pills, and if we don't start to see a response from that and we start to see more swelling and redness, it may require further attention, antibiotic treatments if we're worried about infection. Most of the time, it is just a bad allergic reaction, and we can help you in store.
But bottom line, if you're in doubt, a pharmacist is kind of a frontline person you can go to
Absolutely.
Start seeking treatment.
Yeah, we're always accessible. Come in. We've got lots of options to provide, and we can kind of put you in the right direction of what might be helpful.
Perfect. I'll give an example. We had one of our reporters yesterday. She was icing her toe because a hornet got into her sandal and stung her several times. She wasn't having any kind of allergic reaction, but she was in a lot of pain.
Yeah.
What can you do in those situations?
Something as simple as taking some ibuprofen to help with the pain and the swelling. We do recommend you check with your pharmacist. Ibuprofen is one of those medications that does interact with a lot of different heart medications, so always double check, but definitely helpful. And then there is some creams you can put on as well to kind of take some of that redness and that itch down. But yeah, bug bites can be quite painful sometimes for a lot of people.
For sure. All right, perfect. So speaking of skin ailments, we talk about what exactly is a heat rash and what can you do about it?
So heat rash a lot of times in the areas where we sweat the most, of course, and it can be burning, it can be very itchy, it can red, it can be very irritating. And because it's in an area where we sweat a lot, it can get infected sometimes. So we typically will recommend things like antifungal creams over the counter. And depending on the area of the body, we can recommend a bit of a steroid cream, hydrocortisone sometimes, to help take that redness and that itch away. And of course, trying your best to keep the area as dry as possible is the #1.
Challenging when it's as humid and hot as it is, but yeah, for sure. Okay, one more skin issue, and that is a sunburn. If you get a really bad sunburn, what can you do about that?
Yes, so key is to not let it dry out. When it gets dry, it gets itchy and can start to peel. So just comfort at that point. So keeping it moisturized, so you can get really good aloe creams or gels over the counter. You always just want to make sure that it doesn't have any alcohol in it, so that it doesn't further dry the skin out. I like to put my aloe gel in the fridge, so it's really soothing when it goes on. Little pro tip. And then again, if it's really bad, we can go a step further and do some ibuprofen and things like that to help manage pain.
Perfect. But the pharmacist, again, can help you.
Absolutely. That's what we're there for.
Tick bites. Now, this could be very serious.
Yes.
So what? Okay, you think you've been bitten by a tick. How can you tell if maybe you have Lyme disease?
So #1, call your pharmacist. Come in. Pharmacists in Nova Scotia and New Brunswick can assess for Lyme disease and tick bites, and we can provide a prescription for an antibiotic to help prevent Lyme disease. So we'll go through a series of questions to try to assess whether or not it's appropriate for you. Something you want to get when you remove the tick is to get into the pharmacy as fast as you can, or call, because you've got a 72-hour window once you remove that tick to be assessed and get some treatment. So definitely get into the pharmacy. We can prescribe for preventative therapy to help prevent Lyme disease.
That's great. I didn't know that.
Yes.
That is news you can use. All right, well, Angela, thank you so much for all this today.
Thank you.
And Angela MacNeil is a pharmacist with Shoppers Drug Mart.